Okay, we're going to be showing how to take impressions on the Dexter today, or Darwin. I'm showing the placing rope wax around the borders of the tray. This helps to make the impression more comfortable for the patient and also extends the borders of the tray by about 3 or 4 millimeters to help capture more of the anatomy in the patient that we'd like to capture. You don't necessarily have to place rope wax on every impression, but I think it is useful for many impressions in order to get the anatomy that we want to capture on the patient. A good impression should capture all the teeth, all the soft tissue into the depths of the vestibule, all the necessary anatomy that we want to replicate or that we want to evaluate. And do so without having air bubbles, without having show through. I'm going to try the trays in the mouth, make sure they fit comfortably for the patient. We're not pinching any tissues, and they extend all the way to close to the depth of the vestibule, so we know we're going to get a good capture of the entire vestibule of the patient. Should extend all the way back to the posterior, beyond the posterior of the last tooth in the mouth. If we can, sometimes with third molars it makes it very difficult to get back there. We want to capture as much anatomy as possible. To mix the alginate, I fill the cylinder up to about the third scoop, just a little shy of the third scoop. That allows the alginate to be a little bit thicker and I think a little easier to manipulate and to manage. As you mix it, you swipe and compress the alginate against the side of the bowl, and that removes any air bubbles from the mixture. Make sure it gets mixed entirely, leaving no powder left, and you'll kind of see what the consistency should look like once we get the mix completed. Load the tray, make sure it gets filled completely. And then it can be useful to place a little water either on your finger or spray it onto the alginate just gently and smooth out the surface of the alginate before placing the impression in the patient's mouth. Seat the posterior of the tray first, and then kind of roll it forward to the anterior, holding the lips and the cheeks outward to allow that alginate to go into the vestibule and to the depth of the vestibule. And then seat it down completely without touching the teeth. We want all the teeth and the tissue to be surrounded by alginate. You need to hold it in place for about 3 to 4 minutes while it's set, so it doesn't move, it doesn't shift, it doesn't distort. And you can also monitor the patient to make sure they're not gagging, choking, they're comfortable, and understanding what's happening. Feel the impression to see that it's set completely, and to remove it, if you torque it to the side and quickly snap it to break the suction from the patient's mouth, and then remove it from the mouth. Then we're going to analyze it to make sure it's captured everything that we needed to capture. We've got all the teeth present. We've got posterior to the last tooth in the mouth. We've filled into the depths of all the vestibules. There are some voids or air bubbles in this anterior region that I'm not entirely happy with. In fact, they're larger than I think I would like. However, I'm going to pour this up so you can see what they look like on the cast. If these voids or these air bubbles are in a location that is critical to our impression that we're trying to evaluate, we'd have to retake the impression. And in fact, I may advise to retake this impression anyway, but I'm going to pour this up so you can see what these air bubbles and these voids will look like on the cast. Once we're done with the impression, we should disinfect it and then wrap it in a moist paper towel and place it in a paper bag or plastic bag. And that's going to help to maintain the humidity of the impression, maintain the moisture content so it doesn't either expand due to absorbing water or distort from losing water. That'll maintain the humidity. It's easiest to clean out the bowl, I think, when the alginate is completely set, and then throw away the leftover pieces out of the bowl into the trash. For maxillary impression, again, we're going to try it in the mouth, kind of practice with the patient, let them know what to expect. Sometimes they'll tell you, I gag during this part, and so that would be useful information to know so you can help them get through the impression. If patients do gag, one thing that can be helpful is to ask them to wiggle their toes, to breathe through their nose, sit them upright so they're not leaning back. Essentially get their attention away from what you're doing in their mouth by focusing on their feet, wiggling their toes, calm breathing, and that can help them to get through taking the impression. Again, I fill up just under the third line and then swipe the alginate against the side of the bowl to remove the air bubbles. Load the tray. Again, a little bit of water on top of the alginate to smooth out the surface. We need to place it in the patient's mouth before it starts to set so that we can get a good impression. Retract the cheeks. Sometimes you can do this with the tray. I'm retracting much more than you could on a patient because of the rubbery cheeks. Load the posterior of the tray first, seat the posterior, and then roll it forward to the anterior. And you can see the alginate coming out of the anterior vestibule, and that's what you want to do. You want to fill that anterior vestibule and kind of puff the cheeks out and pull the cheeks down around the top of the tray. Don't let the patient, don't have the tray push the lip up. We want the lip on the outside of the tray. Hold it for 3 or 4 minutes while it sets. And you can reassure the patient and calm them and make sure they're doing okay throughout the process. Feel the impression, make sure it's set completely. Kind of snap it to break the section to remove it from the mouth. And analyze the impression to make sure it's captured everything you needed to. There's a little bit of show through on the tray. This is just the rope wax. I wish it wasn't there, but I'm going to pour this up again so you can see how this appears and how it can distort certain sections of the cast. Again, if we have large areas of show through, we may need to retake the impression because those would be places of inaccuracy, or if there are areas of show through in critical areas that we need to have really accurate for our impression. Place a moist paper towel around it, place it in a plastic bag, and clean out the patient's mouth, make sure there's no extra debris or alginate left. And then we'll need to go and pour up our impressions